Hi, can you please tell me now if I am audible and visible? There was a technical glitch. I could not take the class on time. So I hope there are people who are listening. Can you please tell me if I am audible and visible now? That would help a lot. Send me the link. I will tell you whether you are audible or not. Yeah. Meet, am I visible and audible now? Yeah. Thank you, sir. Yes, thank you, OS. So let's begin with the class today. To introduce myself, I am Dr. Resham Basani, your educator in the subject of dermatology on Unacademy. I am a clinical dermatologist, a consultant dermatologist practicing at Matunga, Mumbai. I was associated with the KJ Somaya Medical College for 10 years before I've now in Unacademy. So with that, I would like you to get introduced to the Iconic subscription. So Iconic subscription is where you get the best of Unacademy and the best of Prep Ladder. Through Unacademy, you have the live batch and courses with live tests and quizzes, while through Prep Ladder, you have video lectures and question banks and rapid revision courses. Also, you should know the subscription costs. So, the Iconic subscription for a subscription of 12 months, it would be around 4,125 a month. For 18 months, the subscription would be 3,300 per month. For 24 months, it will be around 2,888 per month. For 36 months, it will be 2,300 a month. You also need to know that there is just a plus subscription of Unacademy available, through which you will be able to you will be able to access the subscription, which will be at the cost of 4,500 a month. For 3 months, it will be 3,750. For 6 months, it will be 3,375. For 12 months, it will be 12,063. And for 18 months, it is hardly 1,625 a month. You should also be knowing about the NEET PG 2022 test series, which is free. It's live on Unacademy. It is every day at 9 p.m. And similar test series is also at 8 p.m. For that, you just need to download the Unacademy Learning app. Okay. And you can then subscribe to it. And when you do subscribe, you can either opt for the plus subscription or you can opt for the Iconic subscription. When you use this code DRHM10, you will get an additional 10% off. Okay, so there is also a free plan of Unacademy which is available, and this free plan you can unlock by using the code DRHM10. Okay, so with that, I think there are a few people out here. I want all of you to actively participate in the poll. So today we'll be discussing the MCQs which will be related to the nails. So let's begin with that. Yes. So my question is, identify the condition. Look at the nails and you need to identify this condition. You can see here some problem here. Yeah. Yes. So you need to tell me what is this condition that you're dealing with. Let's discuss what we can see. Okay, we can see that there is slight onychomedesis. What is onychomedesis? It is the detachment of the proximal nail plate from the underlying nail plate. So this is onychomydiosis. In addition, you can see this, there is this yellowish discoloration of the nail along with onycholysis. So onycholysis is the separation of the overlying nail plate from the underlying nail bed. Okay, so there are two terms that we learned today. One is onychomydiosis, which is the separation of the proximal nail plate from the nail bed, and there is onycholysis. Onycholysis means there is separation of the nail plate from the underlying nail bed, as well as you can appreciate the yellowish discoloration. Now look at this nail carefully. Here you can appreciate that there are multiple pits. Okay, so if you see these pits, they are irregularly placed, and you can see that they are deep pits. If you see this nail, again you can appreciate the onycholysis along with the irregular deep pits. So now can you please identify what do you think is the diagnosis? Is it alopecia areata? Is it psoriasis? Is it lichen planus? Or is it onychomycosis? Anyone? I would appreciate if people can be more active. Yes, so Puneet says it's lichen planus. Anyone else? Anyone else would like to contribute? Okay, no problem. So see, the correct answer to this question is psoriasis. Okay, so let's take each and every aspect. Now let's first consider alopecia areata. Okay, now alopecia areata is basically going to have the following nail changes. One, there will be pitting in alopecia areata, but please remember that the pitting in alopecia areata versus psoriasis, if you see the pitting in cases of alopecia areata, it will be regular. Okay, and it is going to be superficial, versus in cases of psoriasis the pitting is going to be deep, as well as it is going to be irregular. Second thing which you need to know about the alopecia areata involvement of the nails is that alopecia areata is the most common cause of track it is the most common cause of tracheonychia. Okay, so tracheonychia is nothing but roughening of all the nails. It usually tends to affect bilaterally, symmetrically, and affects almost all the nails and the nails of the feet as well. Okay, so tracheonychia, the most common cause, remember, is alopecia areata. Okay, the next thing that you need to know about alopecia areata is that the pattern of pitting, okay, that has been described in alopecia areata is called as the Scotch plaid pattern. Okay, so please remember the nail involvement in alopecia areata. The pitting in cases of alopecia areata is regular and superficial, versus the pitting in cases of psoriasis, which is irregular and deep. Okay, so next, let's go to lichen planus. Now, I'll tell you the changes of lichen planus. Puneet, you need to know this. The lichen planus changes include: one, most common change of lichen planus is thinning of the nail plate. Okay, thinning of the nail plate is the most common change. The most characteristic change of nail lichen planus is pterygium formation. Okay, what is pterygium? Pterygium is when there is a fold which is coming from the proximal nail fold, okay, and it is causing scarring of the underlying nail blade and is getting attached to the distal nail fold, and that's called as a pterygium. Don't worry, I'll be showing you images of pterygium as well. Okay, in lichen planus, in majority of the cases, you have thinning of the nail plate along with pterygium. Rarely you may also have pitting. You will have subungual hyperkeratosis, and a sign which is associated with lichen planus of the nails is called as the pup tent sign. So pup tent sign is where you have a papule of lichen planus on the nail blade. It is going to cause the elevation, a triangular kind of an elevation of the nail plate. So that's called as the pup tent sign. Okay, now also remember there is something called as onychomycosis. What is onychomycosis? The onychomycosis is nothing but the dermatophytic infection of the nail plate. Okay, so because of the dermatophytic infection of the nail plate, the changes that you see in the nail include: one, there will be a discoloration of the nail plate. Right, fungal infection. Yes, you are right. Rose, you are right. So there is discoloration of the nail plate. So it can be a yellowish, brownish discoloration of the nail plate. In addition, there is subungual hyperkeratosis. What is subungual hyperkeratosis? Subungual hyperkeratosis means there is accumulation of keratinous material along with fungal elements which is situated below the nail plate. Sub means below and ungual means nail. Okay, so below the nail there is hyperkeratosis. There is accumulation of thick material. Again, I will show you an image of this as well, so don't worry. Okay, and in addition, there will be something called as tunneling. Okay, so remember that psoriasis of the nail will show you onychomatosis, onycholysis can show irregular deep pits as the most common finding, but it can also show subungual hyperkeratosis. But how do you differentiate between the subungual hyperkeratosis, which is because of psoriasis and because of dermatophytic infection of the nail, or onychomycosis? Is that in cases of dermatophytic infections, you will have tunneling. Okay, because the fungus will try and go proximally. It starts from the distal end, it tends to go proximally in tunnels. Okay, so tunneling is a phenomenon which you are going to observe in cases of onychomycosis and not in cases of psoriasis. Okay, in addition, please remember the most characteristic sign of nail psoriasis is called as the oil drop sign, also called as the salmon patch sign. Okay, so you need to know all these characteristic signs so as to identify the diagnosis. Now, let's go to the next question. Identify the condition. In which condition do you see this change? To make things easy, let me describe this particular nail for you. Okay, so now you can see this is the nail fold. This is the distal nail fold. This is the nail plate. Here you can see there is some amount of separation of the nail plate from the nail bed. So this is called as onycholysis. Okay, and in addition, what you see is there is a salmon color patch on the nail. Okay, now actually this particular salmon color patch looks like as if there is an oil drop, okay, under the nail, right? So the same kind of a patch you can see in this area as well. So basically, please remember this is the oil drop sign, or it's also called as the salmon patch, which is very pathognomic for patients suffering from nail psoriasis. Okay, so just to revise, what are the clinical features of the nail changes in psoriasis? The first and the most common feature is pitting. The pitting in cases of psoriasis is irregular, it is deep, versus in alopecia areata where it is superficial and regular. Second, the most pathognomic is the oil drop sign. Okay. The third is the presence of subungual hyperkeratosis, which mimics that of dermatophytosis. But how do you differentiate? Is by the presence of tunneling in dermatophytosis. Okay. Now, so the correct answer here is nail psoriasis. Yes, Rose, you are right. Let's go to the next question. Oh, this is just a revision of whatever I already told you. As you can see, the most common feature is nail pitting, which is random, deep, and irregular. Please remember it's also called as thimble pitting. Okay, so this is what a thimble looks like. Okay, so this is also called as thimble pitting, and this pitting is because of the involvement of the proximal nail matrix. This is the oil drop sign or the salmon patch, which is a translucent yellow-red discoloration in the nail bed, which is resembling a drop of oil under the nail bed. And it is pathognomic of nail psoriasis. So remember, the most pathognomic sign for nail psoriasis is oil drop or salmon patch. The most common sign is pitting. This is subungual hyperkeratosis. So here you can see this is the nail plate. Below the nail plate, there is collection of this material. Okay, so that is called as subungual hyperkeratosis. There is no tunneling in cases of psoriasis, while tunnel formations in the subungual tissue indicates onychomycosis. Also, see, this is the picture which is showing you the presence of onycholysis. Okay, so what is onycholysis? It is the separation of the distal end of the nail plate from the underlying nail bed. Okay, so this happens because of accumulation of material under the nail, right? So this is subungual hyperkeratosis. Okay, everyone with me? Everyone is understanding whatever I am saying? Any questions at any point in time? Please let me know. Give me a thumbs up. Right. So if we have to discuss the diseases of the nail, let's first discuss pitting. Okay, pitting is basically a depression on the nail plate due to the proximal nail plate or nail matrix involvement. In psoriasis, as I mentioned, it is random, irregular, deep, and large, where in alopecia areata, it is geometric. There are small, superficial, regular pits in a vertical and a horizontal pattern like this. It is in a grid-like pattern. Remember the other causes of pitting of nails. It includes eczema, where the pitting is irregular, mild, and localized. Extensive pitting combined with other nail changes or irregularities results in a rough nail, which is called as tracheonychia. Remember, trache means rough. So, tracheonychia. Onychia means nails. So, tracheonychia is roughening of nails. This condition is usually bilateral, usually involves all the 20 nails, and hence it's called as 20 nail dystrophy. Okay, so identify the condition. This condition can be seen in all except. Okay, so you can see that all the nails in this particular picture, they have become roughened, right? So basically we are dealing with a patient having tracheonychia. So what are the causes of tracheonychia? Anyone can answer this question? Is it all except? So is it alopecia areata, lichen planus, psoriasis, or vitamin A deficiency? Anyone? Tracheonychia causes. I just mentioned that the most common cause of tracheonychia is alopecia areata. So the answer cannot be alopecia areata. Lichen planus is another cause of tracheonychia as well as psoriasis. So the correct option here is vitamin A deficiency. Okay. So remember, tracheonychia is roughening of all of the nail plates. Tracheonychia is not synonymous with 20 nail dystrophy, but in tracheonychia, most of the times all the nails are involved, and hence it is sometimes called considered to be synonymous with 20 nail dystrophy. So the most common cause of 20 nail dystrophy is alopecia areata. The other common cause is lichen planus and psoriasis. Vitamin A deficiency does not cause tracheonychia. The other name for 20 nail dystrophy or tracheonychia is sandpaper nails. Okay, so typically you have diffusely roughened nail plates. The most common cause is alopecia areata, lichen planus, psoriasis, and eczema. So remember all the causes of 20 nail dystrophy. So this is the classical pterygium. This can come to you as an image based MCQ. As you can see that in cases of nail lichen planus, you have, this is the proximal nail fold, right? So this proximal nail fold, it forms an extension, causes scarring of the nail blade and gets attached to the proximal end of the nail uh, fold, right? So this is called as pterygium formation. Okay, so this is a patient having ventral pterygium. Can anyone tell me what is the cause of a this is a dorsum pterygium. Can anyone tell me what can be the cause of a ventral pterygium? Where do you have a ventral pterygium? Anyone? Okay. Yes, Ovis, you are very right. Ventral terrarium is what you see in cases of scleroderma. Very good. Okay, so please remember this is what a terrarium looks like, and this can come to you as an image based MCQ. So, this is let's go to the clinical features of nail lichen planus. Thinning of the nail plate is the most common finding of nail lichen planus. The most characteristic finding or pathognomic finding of nail lichen planus is pterygium formation or a dorsal pterygium. In addition, the other changes of nail plate lichen planus, you see there is longitudinal ridging. There can be subungual hyperkeratosis as well. So this is a very, or this is an onychoscopic view where you can see that this is the proximal nail fold. Okay, and this proximal nail fold is forming a wing-shaped extension. Okay, and then attaching itself to the distal end of the nail fold. Okay, distal nail with causing of the scarring of the nail plate. As you can see, there is no nail plate here because the entire nail bed has got scarred because of the pterygium formation. It's a permanent change. You cannot treat once the dorsal pterygium has completely evolved. Now, this is the pup tent sign which I told you about in nail lichen planus. Okay, so what is a pup tent sign? A pup tent sign says that there is nail bed involvement that elevates the nail plate into a tent shape. So you can see this is the tent shape of elevation of the nail plate because of an underlying papule of nail lichen planus. So that's called as the pup tent sign. Clear, everyone? Yeah, so I think we have a few minutes more. So let's let can anyone answer this question? Identify the condition shown in the image. Is it a Bose line? Is it a Lindsay's nail? Is it trichonychia or is it Mees lines? You can see that there is a horizontal groove onto the nail plate. Anyone? Rose, Ovis, Puneet, anyone? Syed? No, OIS, it's not the Mees line. I'll tell you what the Mees line. So basically, the condition here that we are dealing with is a Bose line. See, what happens is whenever the body is under any kind of stress, okay, for example, if there was fever or if there was some hospitalization or some surgery, okay, what can happen is there is transient arrest in the growth of the nail. Okay, so after some time, when that potential stressor has been removed, the nail resumes its growth. Okay, so that period of transient arrest of the nail plate is called as the Bose line. Okay, so we'll be discussing all of these. We'll be discussing Lindsay's nail, Mees lines, trichonychia. We have already discussed. Please remember this horizontal groove is corresponding to the phase where the nail plate progression or growth was arrested because of some systemic event. Okay, so this is a Bose line which I showed you in the image earlier. They are transverse grooves which are present on the nail. It may be full or partial thickness through the nail. The transverse grooves may occur because of trauma, inflammation, or neurological event reflecting an acute systemic event, like, for example, myocardial infarction, measles, mumps, or pneumonia. Okay, now these are Mees lines. Otherwise, you can see these are Mees lines. They are also called as Aldrich Mees lines. They are also called as Leuconychia striata. So basically, they are white colored lines which are horizontally placed on the entire nail plate, and they are white lines of discoloration across the nails of the fingers and toes, which is called as Leuconychia. The Mees lines, they typically appear after an episode of poisoning, okay, with arsenic, thallium, other heavy metals, and can also appear if the patient is suffering from renal failure. Okay, so remember Mees lines, remember two causes. First of all, what are Mees lines? Mees lines is nothing but longitudinal white bands on the nails the technical term for which is Leukonychia striata. The Mees lines, they occur after an episode of poisoning with arsenic or thallium. Okay, and it can also happen if the subject is suffering from renal failure. This is Lindsay's nails. Okay, this is a picture showing Lindsay's nails. So Lindsay's nails, they are also called as half and half nails. Okay, why half and half? Because the proximal half portion of the nail is white and the distal half is red, pink, or brown with a sharp line of demarcation between the two halves. It's a rare but a special clinical finding which is found in chronic renal failure. Okay, so remember the cause of half and half nails. Most common cause is chronic renal failure, but it can also be seen in yellow nail syndrome, Crohn's disease, Kawasaki disease, Behçet's cirrhosis, hyperthyroidism, zinc, pellagra, HIV, and even in healthy persons. But for an MCQ point of view, please remember half and half nails are seen in patients with chronic renal failure. So, three entities we have discussed. We have discussed Bose lines, which is transient arrest in the growth of the nail, okay, which happens because of trauma, inflammation, or a neurological event, and it is reflecting an acute systemic event like MI, measles, mumps, or pneumonia. Mees lines are Leukonychia striata, which you see with heavy metal poisoning as well as with renal failure. And half nails, also called as Lindsay's nails, are seen in chronic renal failure. Now, in which of the following diseases is the Muircase lines observed? Cirrhosis, renal failure, hypoalbuminemia, or iron deficiency anemia? Anyone? Where do you see Muircase lines? Rose, ovaes. Rose, iron deficiency anemia, what you get is something called as koilonychia, okay, which is also called as spooning of nails, okay. So, koilonychia is seen in iron deficiency anemia. You don't see Muircase lines. Yes, OS, you are right. The correct answer is hypoalbuminemia. Okay, renal failure, I already told you, we see Lindsay's nails or half and half nails. Okay. So, Muircase lines, they are paired white bands that are parallel to the lunula with pink present between the two lines. Okay, so you see there is this one white band, there is another white band, and between the two you see pink present. So it is characteristically seen in patients with hypoalbuminemia, and it is also seen after placement of left ventricular assisted devices in congestive cardiac failure. So remember, Muircase lines are paired white bands. They are always in pairs. Okay, so you will get paired white bands which are parallel to the lunula. That's very important. This is the lunula. What is the lunula? It is the semicircular whitish colored band that you see more prominently on your thumbnail. It's called as the lunula. So these lines are going to be white bands which are parallel to the lunula and they will occur in pairs, and between the two there will be pink. Okay, between the two whites there will be a pink. Okay, so please remember, Muircase line is seen in cases of hypoalbuminemia. So just to revise, Bose lines in systemic events, Mees lines in heavy metal poisoning and renal failure, and half and half nails or Lindsay's nails in chronic renal failure. Muircase lines are seen in hypoalbuminemia. Okay, going on to the last question that we have for today. The condition shown in the picture is associated with, is it associated with pleural effusion, D-penicillamine therapy, nephrotic syndrome, or all of the above? First of all, let's see what is this condition. What we are seeing here is that the entire nail is kind of thickened. It has become yellowish in color. Okay, as well as you can see there is over curvature of the nail. See, which you can very well see here. There is increase in the vertical curvature of the nail. Okay, so what is this? So basically here we are dealing with something which is called as the yellow nail syndrome. Okay, so where do you see it is associated with which of these following? Is it associated with pleural effusion, penicillamine therapy, nephrotic syndrome, or all of the above? Anyone? What are the conditions that you see under the yellow nail syndrome? Anyone can give me an answer? No problem. See, the correct answer here is pleural effusion. Okay, so pleural effusion, nephrotic syndrome, penicillamine therapy, everything can be associated with the yellow nail syndrome, and hence the answer here is D, all of the above. So the condition is yellow nail syndrome. The yellow nail includes pleural effusions, which may be recurrent. There is primary lymphedema because of the underdevelopment of the lymphatic vessels, and there are yellow dystrophic nails. Besides, there can be chronic bronchitis and bronchiectasis, and the condition may be associated with an increased risk of malignant neoplasms. Other associations include deep penicillamine therapy and nephrotic syndrome. Okay, so the correct answer here is all of the above. So please remember the components of the yellow nail syndrome. You see under this syndrome, you see pleural effusions, you see primary lymphedema, you see yellow dystrophic nails. Okay, and dystrophic nails because the color of the nails was yellow, as well as you can see that the nail plate was quite thickened, as well as there was over curvature of the vertical curvature of the nail plate. And besides, you can also see, in addition to all these features, you can see chronic bronchitis, bronchiectasis can be associated with increased risk of neoplasms, and there is association with deep penicillamine therapy and nephrotic syndrome. Okay, so with that, we end the session here. I hope it has been useful. I would request everyone to please join an academy and at least unlock the free plan using the code DRHM10. So if there are any questions, I think we have around 1 minute left. So if you have any questions, you can let me know. I will be able to answer them. Any questions? Any doubts in dermatology? So since there are no questions, then I would like to end this. Thank you very much for participating. Have a nice weekend. Bye.